Okay, ma'am. We are in live right now.
All right. Thank you.
Good afternoon, all. My name is Rachita Narayan, and I'm a counselor with Symbiosis Center for Emotional Wellbeing, SKU. Today, we are gathered for a panel discussion. Today, we are here for a webinar on schizophrenia awareness. World Schizophrenia Awareness Day is observed on May 24th every year to honor Dr. Philippe Pinel from France, a significant figure in the early efforts to provide human care and treatment for people with mental health conditions. The vision of Schizophrenia The vision of Schizophrenia Awareness Day is to bring world awareness about the disorder and educate people about the challenges faced by the person with disorder and their families. The webinar aims to bring awareness to about the illness to reduce the stigma and myths around schizophrenia. This webinar is brought to you by Symbiosis Center for Emotional Wellbeing. SKU was established in August 2018 and consists of mental health professionals located at various campuses who provide counseling services to our students, staff, and their families. There's a lack of general awareness and a lot of myths and misinformation surrounding schizophrenia disorder and its symptoms. Today, we aim to understand what this disorder is about and with our experts, try to debunk some of these myths. We welcome you all. So on our panel, we have today with us Dr. Ajit Nair, who's currently working as an assistant professor and in charge head of Department of Psychiatry at Symbiosis Medical College for Women. He has done his MD in psychological medicine from renowned government institute, St. G.S. Medical College and Kemp Hospital, Mumbai. He's been in academics with 7 years of teaching experience and 4 research publications in his name in national and international medical journals with special interest in community psychiatry. Dr. Ajit strives to increase awareness and destigmatize mental illness by conducting awareness sessions in the community. Other aspects of his interest include sleep disorders, addiction psychiatry, and depression. We welcome you, sir. The other panelist we have with us today is Mr. Kushal Lee.
Yes.
Sorry. Another panelist we have with us, Mr. Kushal Lee. Mr. Kushal Lee is an RCI licensed mental health practitioner. He has completed his MSc in neuropsychology and MPhil in clinical psychology. He's working at the Nashik campus of Symbiosis Center for Emotional Wellbeing and conducts counseling and psychotherapy for the students, staff, faculty, and the family members. He has been actively working with persons with schizophrenia and their family members. Its specialization includes using behavioral principles and cognitive strategies for the treatment of mental health conditions. He has completed specialized therapy in cognitive behavioral therapy. He has from a recognized institute, and he's also working in corporate sectors and is engaged in his private clinical practice as well. We welcome you, sir. We also have Ms. Asmita Mukashi. Ms. Asmita Mukashi has personally had experience as a caregiver and is currently the trustee and coordinator at Threedle, which is a schizophrenia rehabilitation center and is associated with Institute of Psychological Health, Thane. She is also a coordinator at Surhod, a support group for Shubhankars, which is the caregivers. Her work focuses on helping schizophrenia patients and their caregivers in rehabilitation and social adjustments. Welcome.
Thank you, Rachita, for the warm introduction.
To start understanding what schizophrenia is and just to get our audience acquainted with what schizophrenia disorder is and what it looks like, I would like to ask Dr. Ajit to explain to us in brief what schizophrenia disorder is and what are the few signs and symptoms.
Hope I'm audible.
Yes.
Very good afternoon, everyone. At the outset, I would like to thank the organizers, Team SKU, for allowing me to be a participant in this discussion today. To start with schizophrenia, I would like to say that schizophrenia is a chronic mental disorder. I want to emphasize this particular fact that it is a mental disorder. It's an illness. Still today in our society, we find people thinking about it as some sort of split personality. These are the myths and various misconceptions which are attached with this illness. A person is behaving in different way at different places. So this is what schizophrenia is. No, this is wrong. Also, the person is possessed by a ghost or some paranormal force is entering the body of the person. All these particular myths and misconceptions have to be removed from our minds, and we all need to understand, not only the mental health professionals or the doctors, but also the people in the society need to understand what schizophrenia is. This disorder occurs in 0.3 to 1% of the general population, and it can affect people of all cultures, religions, and those who are from various socioeconomic group and gender. It equally affects males and females. The typical age of onset of schizophrenia is between 15 to 25 years, and it can occur early in men as compared to women. Schizophrenia is a clinical diagnosis. Unfortunately, today we don't have any specific blood test or a specific CT scan or MRI finding which diagnose schizophrenia. Therefore, we need to understand the various cluster of symptoms, the signs and symptoms of schizophrenia, so that we can diagnose it. Broadly, what we have to do is we can take a good history from the patient's relatives and conduct a mental status examination on the patient. If it is done thoroughly, then we are able to diagnose this particular condition in the patient. We'll divide the signs and symptoms into two parts: positive symptoms of schizophrenia and negative symptoms of schizophrenia. The positive symptoms of schizophrenia includes delusions, hallucinations, and disorganized thought process. Let's say it one by one. Delusions. It is a thought. It is a belief. It's so firm and it's false. Actually, that is not what the situation is, but the patient thinks that this particular thing is occurring with him. For example, they may feel as if people are out to get them. They are there to harm them. They are poisoning them, they talk bad about them. But actually, when we talk to the relatives and provide evidence that this is not the scenario, but still the patient does not at all listen to it. They're very firm with this particular belief of theirs. Therefore, we call it as a delusion. It can be various types where delusion, there can be a delusion of persecution, there can be delusion of reference, delusion of grandiosity, where the patient may feel as if he or she is a big person, known personality, etc. Then there are hallucinations. Normally, whenever we hear something, there is a stimulus in the surrounding. There is a source in the surrounding. But in case of hallucinations, even though there is no any source in the surrounding, still the person is able to experience that particular sense. It can be auditory hallucinations where the patient is able to hear some voices which comment about which abuse them, or they talk to them, or there are some voices which talk to the each other, commenting about the person's behavior. That is so scary. Person with suffering from schizophrenia really gets scared after listening to all these things. Third is about the disorganized thinking patterns. Here, the person is not able to organize their thoughts in such a way that they can communicate. There can be one thought which starts, and then on this immediately they can go with a different idea which may not have a logical connection with each other. As a result, this particular speech, whatever they talk to us, is not very comprehensible. In addition, they may have thoughts like that their own thoughts are not under their control, as if someone is inserting thoughts in their mind, or their thoughts are taken away, which is very unrealistic type of thinking. Such disorganized thoughts can also be accompanied by disorganized behavior, where the person may be found wandering out of the house, disheveled, collecting garbages, which we do encounter when we do walk on the streets of various cities and villages. Apart from this, there can be emotional disturbances. With all these experiences, we do expect patient to be fearful, right? So patient may get scared, they may have irritability, or in their own world, where they may think that they may be harmed, they may act in a defense, they may become aggressive. So we have to understand all these positive symptoms, and along with them, there can be negative symptoms where the person may have a behavioral change, but they are asocial. They don't like mixing with others. They just be with themselves. They not take care of themselves, not eat food. They may lose weight. You may find them talking to themselves or like making some gesticulations in the air. They communicate less, alogia, they don't talk much. When they develop this particular illness, they don't interact that much with their family members. If you look at them, you'll find that they are expressionless. They are not able to express their views or their feelings, or at times they may not experience their own feelings. That is what we call as apathy. They may have attention problems, concentration problems. This is what we call as the negative symptoms of schizophrenia. So, presence of majority of these symptoms along with a socio-occupational impairment. When I say socio-occupational impairment, means the patient, any person, has their own social and occupational role to satisfy. If they are not able to satisfy their role, and these symptoms, along with this impairment, if it lasts for 6 months, we say it as, we call it as a diagnosis of schizophrenia.
Thank you so much, sir, for explaining us the medical signs and symptoms associated with schizophrenia. But often it's seen that schizophrenia is seen as a big disorder and it's hard for families to accept that as well. So I would like to ask you, Mr. Kushal, what is the attitude of family members around a person with schizophrenia when first they hear about the diagnosis?
Hi, Rashida. So a lot of time when they are not aware of the illness, they tend to first, feel unacceptable that what the diagnosis is, and they like if we talk more about the perception of people around the schizophrenia. So a lot of time their aggressive behavior, they are perceived as if they are dangerous, you know, and because of that, people feel that they can be harmful and they can be causing problem, uh, to the people around them. So that is something even family member can see that their person with schizophrenia, he's likely to make them feel awkward around them, and they may feel uh, you know they may feel ashamed of it. So that is one thing. Another thing is they are often this person often struggle with doing their day-to-day activities and may not show much interest, be very less active. And when family members see that, they 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 behave as if the person is irresponsible, is not taking the responsibility of the illness. You know that is something we can be seen, and they are being over dramatic, but they fail to see that this may be the part of illness itself, and it's not that the person is deliberately behaving in that way. So that is something even the therapist can help them understand, that these symptoms are not the deliberate one, but are the manifestation of the illness itself. So that we have to target when we are dealing with the person with schizophrenia and their family member. And often they are also, we can see that they are discriminated in social settings. And in the social settings, what we see that like what we can see here, that even in healthcare setup, I would say uh, the therapist or the doctor, they struggle to disclose the accurate information or even to the family members. And because of that, the person may not understand what is happening with him, and and they may not, and they may not you know support to the treatment that is taking. So the aim of the therapist here would be to firstly explain what kind of the nature of illness is, and how it can be seen over the duration, and how they can help the person to remain active in the treatment, and just not being very harsh towards towards the person itself. So that is something we can focus here.
Thank you so much for explaining us the reaction of the society and the people around. And of course, that does affect the whole family together, and especially the loved one, the close ones around them. Coming from that, Ms. Asmita, ma'am, would you like to explain us a little about your personal experience of being a caregiver and how our situations might or might not have been differed from then to now? Is there something you think there's a difference which has come about in these types of stigma around people with schizophrenia?
First of all, let me take this opportunity to thank all of you that you have allowed me to join all these technical people where I am not a technical one. I don't have any technical knowledge, but like I have the experience, means I am giving care for last 32 years. So, so maybe please excuse me if I use some wrong words, and please correct me. Actually, see, this is I'm talking about 1985 when I'm caregiver for my husband, and he was diagnosed having a schizophrenia in the year of 1986. That time the information was not so easily available. Getting the information was very difficult. So when like doctor said he is suffering from paranoid schizophrenia, so what that exactly means, it took years for me to realize what exactly the schizophrenia means. Uh, Second one is that we are living in the so there are two caregivers, two set of caregivers. One me as a spouse, and other one is his parents. So naturally, our reactions to this diagnosis was totally different. That could be because of the relationship with the patient. See, they being a parent, they were more emotional, and me being a spouse, I was more rational. So naturally, the reaction of it was different. They were more towards it is a evil spirit, it is black magic, and so he needs to be treated in that fashion. And me being a science student, I just wanted him to go to doctor, psychiatrist, and take the medicines. And fortunately, I have a good family support. So along with my own family, we came to the consensus that yes, whatever, if they want to do all this god related thing, they are free to do that, but medical treatment is must, unless and fortunately even his parents agreed to that. And that is how our journey has started. First was a conflict, and then we realized that goals of all are same, that his well-being. So why unnecessary make the conflict? And then the journey was little bit better. Of course, there were difficulties handling him, and as you said rightly, the stigma and denial, even his parents has denial, I was in denial, but our denials were different. His Their denial was like, it cannot happen to my child. We do not have anyone with this history, how he can get it? And then along with that came lot of blaming. But my denial was, I was like intellectually knowing that he has schizophrenia, he needs some medical treatment, but that's it, full stop. Miss, my denial was acceptance of deficits. Means I was not ready to accept his deficits because of the illness. So once that acceptance came, the journey became smooth. Otherwise, like I was expecting like he should progress in his career, he should socialize, he should take me to whatever social gatherings or dramas or movies or like whatever a newly married wife would have from the husband. because I know he has schizophrenia, but what does it mean? I didn't know, unfortunately, that time. But slowly, then I understood what exactly it is, and then what are the deficits. Then my life goal has changed. Then I have realized that whenever there is a conflict between me and my in-laws, his illness would increase. And then I realized this is not going to help. So we should be like, whether you, for his betterment, we should keep our difference of opinions at least in front of him. We should keep it aside, and that really has helped us a lot. So basically, as a caregiver, I feel that the acceptance of the diagnosis and acceptance of the deficiencies because of schizophrenia is crucial factor in the prognosis of patients illness or schizophrenia. That is what, as a caregiver, I feel.
Thank you, ma'am. That was very insightful. Coming from the personal experiences gives us much more insight from what a family goes through. Thank you so much. So coming to, as you mentioned, prognosis and how the treatment is being treated. So I would like to ask Dr. G, how do biological factors contribute to the development of schizophrenia?
Before going to the biological factors, let me tell that in medical terms, we call it as biopsychosocial model. It's not only the biology which can lead to development of symptoms of schizophrenia, but also various psychological factors and social factors. And all of them, they come together, then there are more chances that a particular person may develop this particular illness. When we talk about biology, now what is biology? To explain it, I would say our body has a lot of cells, tissues. All these cells are made up of genes. There are various hormones in our body, right? There are various physiological processes which are going on, like we breathe, right? So this is what is nothing but the biology. There are three main factors in when we talk about biological factors which can lead to these symptoms. First is the genetics. Second is the neurotransmitter imbalance, and third is the presence of chemicals, use of addictive substances like alcohol and cannabis. Now, talking about genes, there are certain genes which have been found to lead, which can lead to schizophrenia. There are certain like COMT or DISC1, which are found consistently in various patients suffering from schizophrenia. There are others which are inconsistently found. Research has found that this particular illness runs in families. For instance, if there is one parent having schizophrenia, then the chances of a child having it are 10%. If both the parents have, then the chances of the child having it are 40%. So this indicates that genes have some role in the development of symptoms of schizophrenia. But as I mentioned, they are not the only factor which can lead to. Definitely, genes can increase the vulnerability of the person to develop the symptoms of schizophrenia. Secondly, about the neurotransmitters. Now, what are neurotransmitters? When we talk about our brain, there are various brain cells. One particular brain cell is not connected to the other. There is a small gap in between. Into this gap, if information has to pass from one cell to the other cell, then in this gap, there is secretion of some chemicals, which we call as neurochemicals. Research has found that increase in the concentration of dopamine and serotonin in certain brain regions can lead to the symptoms of hallucinations, delusions, that is the symptoms of schizophrenia. Therefore, medicines which are used in the treatment are also anti-dopaminergic, anti-serotonergic, as they block the receptors and the patient's symptoms start improving. Thirdly, talking about the substances, alcohol, cannabis, and other hallucinogen substances, they can increase the tendency of hallucinations and taking the person into their own world. That is the lose touch with reality. So these hallucinogenic drugs can either trigger the symptoms of schizophrenia in a person who is already vulnerable, or they may, with excess use and on long-term use, can themselves lead to the symptoms of schizophrenia. So these biological factors we have to take into consideration along with the various psychological and social aspects, because we have to deal with all these things. It's not only the medications which will be taking care of the symptoms, it will also be the various social factors, maybe family related or the psychological makeup, the coping related, the way of thinking, the way a person thinks. They have to be taken care of when we think of the recovery of patients with schizophrenia.
Thank you, sir. And thank you for especially mentioning that these factors play a role, but do not necessarily means a person will definitely develop schizophrenia because their parents or someone in the relation had it. It does add as a risk factor and increase the chances of developing it, but so still does not mean that definitely the person will get the disease. As you mentioned that there are a few psychosocial factors as well which play a role. I would like to extend the question to Mr. Kushal. So do you think what are the social and psychological factors which play a role in developing the disorder?
So as Asmita ma'am rightly pointed out that the conflict between the parents, it also affects the child, and where the child experience the stress, and because of this stress, they are likely to have the symptoms of schizophrenia. It's not limited to schizophrenia; they are also likely to experience other disorders as well. But that could be the one reason where I talk about having dysfunctional family environment where they are not learning how to communicate. They are having this deficit. They do not know what is the appropriate behavior when it comes to behave in a social situation. And because of this, they also tend to have some deficit in social behavior. They may struggle to initiate the conversation or maintain the conversation. So that is one part. The other part is if living with single parent or divorced parent can also be the risk factor that can play a role, or where the child is being neglected by the mother or by the father, where their emotional needs are not met. They have not received the affection, that care, that support, because of which they may experience the stress, they may experience the sadness, they may feel anxious. And these are the foundation period where the child is learning about the people, about the world. And with this early bad experiences, they tend to have beliefs that are not helpful, that are not healthy, and they often struggle with that. Along with that, people coming from poor economic background, where they do not have enough resources, they can struggle with meeting their basic needs, and because of this they may have lack of nutrition, and that can even lead to the symptoms of schizophrenia. And then losing parents or losing job, failing in the academic, these are the things. But I would like to emphasize here, when this adolescent, mostly when they reach the adolescent period, and this is the period where they want to explore self, and in that exploration, they reach out to the different experiences they want to try, and they also want to fit in the culture with the, let's say, in the college, and all of the people are like going to the club, taking the substances, and because of these substances, as Dr. Ajit has pointed out, they can experience this positive symptoms, hallucinations. So that is one part. That if we talk about the social factors, specifically talking about the psychological factor, as I said, if they are not provided with enough an appropriate behavior, they may tend to shy. They may not have the confidence to speak in public. They may withdraw themselves from talking in the social situation, and they excessive worry about their behavior, and they fail to interpret the cues, social cues. They fail to interpret the emotions of others and what it might mean, and because of that, they can experience stress. And there are these other temperaments, what we call that they can also play huge role in developing the symptoms of schizophrenia, such as like you can see that they are inactive and they have less interest, and they may so be unstable, and may easily give up things, and they do not know how to cope up with the situation, so lacking coping skill, that is something, or not able to manage their stress, can lead to the symptoms of schizophrenia.
Thank you, sir. Thank you for explaining these social and personality factors, which also play a role in developing schizophrenia. So once a diagnosis is made, how do we go about with the treatment? If Dr. Jeet, could help us understand how can schizophrenia be treated?
Treating patients with schizophrenia is a teamwork. You have to understand this. A single person, a psychiatrist, a psychologist can't do anything. But as I mentioned, biopsychosocial, all these factors do contribute into the development of the symptoms. So a team comprising of psychiatrists, psychologists, psychiatric social workers, and most importantly, the family members. As we have Asmita ma'am with us, and we have this example in front of us, where she has been a great support to her relative in this process, and that is where we have to keep in mind that everyone have to work towards achieving this goal of recovery when we talk about these symptoms. Considering the biological aspects of treatment, what we generally do is use certain medicines which will help in reducing the positive and negative symptoms of schizophrenia. Is treatment must? The answer is yes. Why? Because if we don't treat, then the disability in the patient goes on increasing. The patient becomes more and more withdrawn. As a result, the initiation, as I mentioned, the person is not able to initiate any activity, they become socially withdrawn, they don't eat food, they don't take their care, and as a result, they may land up into various other medical problems or other medical diseases. So treatment is must. Secondly, if this is not treated, then the disability which increases can be a burden for the family. And this caregiver burden can again be a stress for the patient, the people in the vicinity. When I say vicinity, it's about the family, the caregiver burden in the family. Third is about, so there is a concept called as duration of untreated psychosis. The more is the duration where the person is not treated, the poor is the prognosis. Therefore, if we start treatment as early as possible, then we can definitely expect a good prognosis in the person. Okay. When I explained about the symptoms of schizophrenia, they were the frank symptoms of schizophrenia. However, there can be a stage where a person may have pre-psychotic stage, which we call as a prodrome stage. A prodrome is a state where we will not find all these frank symptoms of psychosis, but the person may have some vague hallucinations sometimes, or they may have some vague suspicious thoughts. They may complain of lethargy, they may complain of tiredness, the initiation in where activities of daily living they may not be able to carry out. So slowly they get diverted from the mainstream and they start becoming aloof. So even though those frank symptoms of schizophrenia are not there, early identification of this prodrome is equally important, because what generally is found is this prodrome may last for about 9 to 10 months before development of frank psychotic symptoms. If we lose this time, then it is found that the prognosis definitely changes. Therefore, it's important that we also identify these prodromal symptoms as early as possible. Coming to the medications, as I mentioned, dopamine and serotonin in the brain increase when the patient develops symptoms. So use of antipsychotic medication is the first line of treatment. anti-dopaminergic, anticholinergic. These medicines, they block the various receptors in the brain and help in reducing the positive symptoms and the negative symptoms of schizophrenia. So the hallucinations go, the thought process start becoming more clear, the perplexity, confusion which the patient has, it starts going, sleep improves. When the hallucinations go, the fearfulness goes down, they develop more confidence, their interaction improves. This is how medicines help. Generally, if the patient is cooperative, we start with a low dose of medicine, and depending upon the requirement, gradually we increase the dosages. Sometimes, as I said, there can be delusion of persecution, where the patient may feel as if people are against me. So they may not be willing for treatment. In that case, we have to admit them and we have to use the intravenous and intramuscular injections, which are the same medicines, but they are given in this way so that the symptoms can be immediately controlled and the associated aggression can be taken care of. Why we need this treatment? Because if we don't treat, there are chances that the person may harm themselves. This is what research has found. Most untreated patients with schizophrenia at times may develop suicidal tendencies and may harm themselves. So early treatment with use of intramuscular intravenous medicines in case of non-cooperativeness is also equally important. With time, if the patient gets stabilized on the medicines or they wish to continue medicines, but they get bored by taking medicines, then in that case, we do have options of long-acting depot injections. These are also the same antipsychotic medicines which where an intramuscular injection is given once in a month, and then patient does not require to take oral tablets every day. Okay, so there are various treatment options available when we talk about medications. A second treatment option, which is generally not much preferred by patients, is the electroconvulsive therapy. However, I would like to tell that it's a very safe and very good method of treatment, where a small electric current is like in around 800 milliamperes in under general anesthesia is given to a patient when the patient develops seizures under controlled environment. The development of seizures is nothing but a therapeutic seizure and takes care of the symptoms of schizophrenia. So it's a treatment. It's not used in a lot of patients because of availability of very good medicines recently. Around 30 years back, the scenario was like there were hardly 3 or 4 medicines which would lead to a lot of sleepiness, it would affect the functionality. But today, we have very good oral antipsychotic medicines available, which even not only helps in improving the functionality of the patient, they are also less sedative, and additionally, they also help in improving the cognition of such patients. So they are very good medicines which are available right now. So because of availability of these medicines, electroconvulsive therapy is least used, but we definitely use it in case when the aggression is so high that medicines don't control it. Secondly, if the patient is homicidal, that means the patient is trying to harm others or self, then ECT is the preferred option because it helps in immediate control of symptoms. And thirdly, even with use of oral medicines for a long duration, say like 1.5 to 2 months, there is no change in the symptoms, then ECT definitely helps in making the change in the presentation of the symptoms. So it's a safe option which we generally use for patients. Apart from this, it's a common question which most people do ask when we are giving medicines, what are the side effects of the medicines? As I mentioned in the past, most of the medicines would lead to weight gain and sleepiness. Okay, newer antipsychotics, whatever which are available, they are more, I would say, they are not that much. They don't lead to a lot of weight gain, but and don't lead to the various neurological side effects like tremorlessness and dystonia, which was very common with the antipsychotics which they were used in the past. So recently we have risperidone, olanzapine, and other second generation antipsychotics which can be used with proper care. So before starting all these medicines, what we do is we check the metabolic profile of these patients. We check the weight, we understand the lifestyle, and then we introduce these medicines. As I mentioned, low dosages. Start with some low dose, then we gradually increase the dose depending upon the requirement. And after every 6 months, we do again monitor the blood levels about how there's lipid profile, how is the sugar levels, okay, which with prolonged use these medicines may cause. So we keep a monitoring of all these metabolic profile of patients with who are taking antipsychotic medicines. So these are the various options which we have now, and considering the side effect profile also, they are well tolerated with time. Sometimes patients may develop extrapyramidal reaction. That is the main reason why most people become non-compliant with medicines. When we ask them why is it that they discontinued, most of them say that we develop side effects. So they may develop tremulousness or some sort of salivation or dystonia, where there can be involuntary contraction of muscles. The muscles may get automatically contracted and that can be painful. In that case, we have to reassure the patient that these medicines at times may cause them, but it's not that common. And even if it happens, there are certain other medicines like anticholinergic medicines which can take care of these extrapyramidal reactions. Okay. So these are the various treatment options which are currently available for treatment of schizophrenia.
Thank you. Thank you for explaining all the various treatment options and the differences which have came over the years as well. So a common question people have with schizophrenia is that is a full recovery possible, and what are the likelihoods of experiencing symptoms post-recovery from schizophrenia?
When we talk about the treatment of schizophrenia, this is a chronic disorder, and therefore the treatment lasts at least for a year. The medicines which we give are not like fever-like medicines. Okay, when someone gets fever, we can take paracetamol, and the next half hour the fever goes. Right? This is not what happens with the symptoms of schizophrenia. When the patient takes medicine, it takes at least 3 weeks for the medicine to act. And even after 3 weeks, we can expect more improvement in the symptoms with the same dose in the next 3 to 4 weeks. So the effect of medicine is gradual. Therefore, these medicines need to be given at least for 6 to 8 months. If it's a first episode, we generally treat the patients for 6 to 8 months, and then we gradually reduce the medicine and stop. So this tapering of medicine has to be done under supervision of a psychiatrist. Now, talking about the relapse. It is found in India that as compared to the Western population, the prognosis of patients with schizophrenia in India is good. 70% of patients are found to recover and are found to have a good functionality. Of these 70%, 30% develop one single episode in their lifetime, and when they take treatment for the next 9 to 10 months, then later they may not require treatment. Other 40% may develop intermittent relapses. But when I say relapse, it means when the patient has symptoms and it's treated, the symptom go. But if the medicines are stopped, then there can be again exacerbation of symptoms. So this is what I mean when I say a relapse. So they can have relapses, but still it is found that if they take medicines regularly, then they can maintain a good functionality. However, remaining 20 to 30%, it's found that they may have relapses, but there can be some residual symptoms, like they can have intermittent hallucinations, intermittent irritability, or withdrawn behavior where their interaction with the people in the family or the society can be less as compared to their personality before the development of the symptoms of schizophrenia. So, but as I said, majority of the population in India did have a good prognosis and good functionality.
Thank you so much. Thank you so much for explaining about how the treatment and after the treatment, how it slowly tapers off, and giving hope that in India itself, there is good prognosis present. So as you mentioned earlier, that there is a team present when talking about treatment of schizophrenia. So I would like to extend the question to Mr. Kushan. What are the psychological therapy modules available, psychological therapy options available for people with schizophrenia, and how does that help?
Okay. So, talking about the psychological therapy, so there are, we can say, psychoeducation is the most important part, and then there is cognitive behavior therapy, most commonly used, and some part of behavior therapy where we say social skill training that is very much required. So let me help you understand one by one. So psychoeducation is the most important one, where that is the first time we meet with the patient and the caregivers, family members, and where we have to focus more on collaborative relationship with them, so that they can be they can feel that this burden that they are carrying of illness can be shared, and that this burden can be managed with the team efforts. That is very important part where we work on, and then they are educated more about how the what is the nature of the illness, and how long it may last, and how do we usually proceed with the therapy procedure, and what is the therapy procedure like, and what they can expect from the therapy, why therapy is important. This is very much important to understand that. And when the family members are supportive, when they understand what the illness is, this in turns also help the patient to support to the treatment and have the positive family environment where they can also take in charge of themselves and support to the treatment. So that is the important part of psychoeducation. And then talking about cognitive behavior therapy, what we usually do here, for example, let's say the person has this belief that his colleagues are against him, and in cognitive behavior therapy, we help the person to evaluate this thought, that how far is this true? What is the evidence that we have for this thought? And is there another way we can look at it and be judgmental about it, non-judgmental about it, and then modify this thought, this erroneous thought that the person might be having, and we help them to go out in the environment, use their reasoning and their experiences to change this, unhelpful or unhealthy thought, and to have more adaptive one, so that they will help them to be to be with others. So that is the focus of cognitive behavior therapy, and specifically talking about social skill training. So when a lot of time when schizophrenia it's developed during the at as early as adolescent period. So this these people, they have not acquired the necessary social skills that can help them to perform the social appropriate behavior. So the idea of social skill training here is to understand that how to interpret the emotions of others, and how to understand the meaning of what has been said to them, and most importantly how to respond, like in assertive way. There are things that they will receive criticism from others, and at times they are likely to react abruptly, and that may not help them, and that may people may avoid them for that reason. So helping them to remain assertive, like how to communicate that they have been heard, but at the same time what they would like to be treated. So remaining assertive, saying no, and saying yes, that is something they can be taught here. And then also how to initiate the conversation using the non-verbal behavior, like maintaining eye contact, maintaining social smiles, and how to sustain and how to terminate the conversations. Because at times, like person has come and he has greeted the person with schizophrenia, and they talk something for a while, and in the middle of the conversation, the person with schizophrenia may leave the conversation, making it the person feel uncomfortable or unwanted. So helping them to understand how to terminate the conversation is also very important here. And how we do that is we teach them some, like we model them, we do the role play in the therapy. Like we create the situation that is hypothetical, and we help them understand what could be the appropriate behavior. And during the role play, we pay the close attention to how they are responding, and then they are offered some corrective feedback that how they can improvise themselves. And very importantly, this has to be generalized. Now they are learning this in the therapy room, but the most important part is how they will do it outside the therapy room. And for this generalization, they are given homework, they are given assignment, so that they can go in the real environment and try these new skills that they are learning. And they are also provided with some reinforcement, how to motivate themselves to carry out this behavior. So that is one important part when it comes to social skill training. And then they are also focused on um, you know how they can function in workplace setting. So what we call is vocational rehabilitation, where they have to when they go at their workplace, the people around them has to feel secure and not to be threatened by them. And using these social skills, they can be taught how to uh, manage their behavior at workplace, how to respond, how to communicate with their colleagues, without being impulsive. So that is something we can focus in the social skill training. And the very important, as what Dr. Ajit has said, including family. Family is very important part when it comes to the schizophrenia illness. And it helps us to prevent the relapse that might happen, that you wanted to know about it. Is there the recovery possible, and are they likely to relapse? So the very reason they can show relapse is how the family is interacting with them. And because of this family's reactions, emotional reactions on them, if they are unhealthy, they're likely to feel stressful and get the relapse. So the family plays important role in preventing the relapse and improving the treatment outcome.
Thank you so much for explaining this and explaining why medication and therapy should go hand in hand when treating someone with schizophrenia. As you have mentioned, and it has been brought up a lot of times, that family plays an important role. I would like to ask Asmita ma'am that over the years, what approach by family during the treatment actually helps with the adherence, like what family could do during the duration of the treatment and how the family reacts. Ma'am, you're on mute.
Sorry, Mr. Kushal and Dr. Ajit, he said rightly, like the family plays very crucial role. Basically, first thing is that the family itself is under pressure because they are seeing their loved one deteriorating in front of their eyes, and like they have very little to do anything about it because the medicines, that doctor said that the medicines will take at least 2 to 3 weeks to act upon. Plus they have a lot of side effects, and then there are so many misconceptions about the medicines. that they are just the sleeping tablets. If you just take the medicines, then it will means it's a habit forming. These all are misconceptions. But initially, when the family hears these things from other people, they get they get confused what exactly needs to be done. But what I feel is that if we trust our psychiatrist, if we trust our therapist, and as rightly said by these two, if we work as a team, the family really can do wonders. Because in my case, I can really want to share, basically, since he had a late onset, he was highly functional, but he could withstand all the pressures in government organization. He has achieved a highest position in the organization, and he retired. So that much he could do because we all worked together. Otherwise, it is not a job of a single person or just a family. So family first has to. Another thing is that I feel that the family should lower their expectations, because once the symptoms are reduced, we as a family member feel that he should function as good as how he was before the onset of illness. And unfortunately, it doesn't happen. Means at least maybe in olden days, maybe now the functionality is restored more with the newer medicines. But yes, still the functionality doesn't come to the fullest. And we caregiver always keep comparing our loved ones with what he or she was before the onset of illness. And that actually puts more burden on the caregivers themselves. So that one thing, I think, as a caregiver, we should take it into a and we should focus on what are the things within our control. Caregiver has a tendency to they just keep on finding out why this has happened, but nobody will get the answer of that why. And in that, we are wasting a lot of energy. So instead of why, I think we caregivers should focus more on what these are the things, and what I should do now, what best I can do with the help of professionals with my kid. If we keep that approach, I think the family would be more supportive. Another thing is that because of the stigma attached to it, or maybe because of the weird symptoms which our patients show, the family doesn't involve the extended family members in the treatment part of it, which again adds to the burden of the family members. Because they restrict themselves socially, because we always feel suppose if I take my child to a function and if he behaves inappropriately, so people will ask, or maybe we are afraid that people will ask, what is he doing now? Which I don't have any answer. Even unfortunately, that child doesn't have an answer. And so we just stop going for the social gatherings. So I feel if we involve the extended, see, we can just pick a few members who can be empathetic with you, and you feel that they are good and they can be of any help. Then we can just tell about, we can psychoeducate them, what is this and what is happening, why he or she is behaving that way. So it can be a good network for caregivers. And then at least my child will be comfortable with that family, and I will have at least 2 or 3 places to go and move around freely without bothering that my child should behave in a socially appropriate way. So I feel if we do it that way, it will be really of a great help. Otherwise, what happens, I don't go out, I don't allow my child to go out, and then first of all, he is preoccupied, he doesn't like to do all these things, and on top of it, even we are not coaxing him to do that. So it is totally gone there, that skill is totally gone. So I feel as a caregiver, we should try to involve other family members. Even if one sibling, we have seen the cases in which if there are 2 siblings, the younger one has an illness, so elder one doesn't know that my younger one is suffering like this. So if parents keep them aside, parents, they don't tell the truth, what is happening. I feel this is not good, this is injustice. injustice to the younger one also, because one fine day what happens if the parents getting old, then the suddenly that burden comes onto the younger one, and he doesn't know what needs to be done, how to help how to help. They have the intention to help, but like they don't know what to do, like they are in just fix. So I feel the prognosis, if you really want to help the child, the family should be more open, instead of thinking about what people will talk about me or my family, or what people think. How can I get help from others? That should be the focus. And I think for that, the care, I know that all the people are not good, they have some vested interest, but yes, but we can, I am sure the our still till now our society is good, and if you look around, you will find few people whom you can trust, and then it will become a network for you, and which will reduce your burden. And I feel in that it is not necessary that they are your relatives, they are your extended family. I feel at least you should involve the neighbors in that, because they are the one who can be of help if emergency arises. So I feel we should find one or two neighbors to whom you can give some idea, so that they can be of any help, they can be of help. And luckily, I got a good support from my neighbors, even from the bosses or the colleagues from my husband's office. And so I feel ki if you present yourself in a proper way, if you have a clear goal, why you are asking, what you are telling, and why you are telling, why you are, what is that you are expecting from the other people, then you definitely find the support which is needed to. But yes, nobody will come and offer the support, because again that can be mistaken as they are poking the nose. So I feel as a caregiver you should be free, and for that you should first free of stigma, because see, this is neither my fault nor my child's fault. It just happened, and it can happen to anyone. But unfortunately it is not happening still. But I am seeing this things are much better. We are conducting psychoeducational workshops, and nowadays we are seeing that many extended family members are attending these, even support group meetings. Many extended family members, friends, they have started attending the meetings. So definitely the things are changing in a better way.
Thank you so much. And thank you for highlighting the aspect of a community which is important when treating someone with schizophrenia. And of course, aspect of what stigma plays a role and how family should actually help bring community and bring the person back to the community as well when dealing with schizophrenia. As we are talking about family and how family can also better support the patient, I would like to ask Mr. Kushal that how do caregivers and loved ones respond to the person with schizophrenia? And are there any therapeutic intervention which can actually equip caregivers better to support the patient and accept the diagnosis?
So, as Asmita ma'am said, that family members tend to have this expectation, great expectation from the patient himself, that how long they have to take care of them. And because this is a chronic condition, family members, they start experiencing this, hostility or rage toward the patient, and at times they end up, showing that aggression. They increase their tone, they shout at them and tell them, the patient, that that they are frustrated because of them, and that these patients are deliberately causing problem to them, and that they are being burdened to the family. Like it's hard for them to, work with, it's hard to be with them, and that they are not following what they are supposed to when they are advised. So that is something they feel. And they also, feel that, like they can wish to live away from this patient, like how hard it is for them. And they get easily angry, and and they feel that irritation. So that is one part, but the opposite one also happens, where they feel that they are responsible for what has happened, and that it is them, because of them, that this has happened, this illness has occurred, and they feel guilty because of it. And because of that guilt, they tend to have some reparative efforts. They become more protective toward this person, and blame everything for what has happened, and not allow the patient himself to carry out the activities. Like, they don't allow to speak in public, they don't allow to you know go out somewhere and buy things for themselves, and they tend to extra care, like, I will do for you, you don't have to worry for it. And that does not help the patient to grow and learn the appropriate behavior. And these are the things that we can see the caregiver feeling. And when they do it, when they feel overprotective, they end up caring a lot, doing a lot, and because of that, they feel burnout, and they are not taking enough care of themselves. That they don't have time for their needs, but they have time for the patient's needs. So this therapeutic intervention can help the caregiver to understand that they have to maintain the barrier, that they have their own life, and they have to do things that makes them happy. And it doesn't mean that if they take care of themselves, that it is, and that how they are responsible for the patient behavior. It doesn't mean that they can have their me time, and this therapeutic intervention can also help them understand how to communicate with person with schizophrenia. When the positive symptoms are active, when the client is hallucinating, when they are having delusions. So instead of convincing them that they are wrong, helping them to understand that this is the part of symptoms, and they do not necessarily have to correct them or make them sit and talk about it for again and again. And why can't you understand? There is nothing like that happening around, and that does not help the client or the patient with schizophrenia, and it tends to add more stress to them. That how their family member are unsupportive, they do not trust the family member itself. As a result, they maintain distant, and it becomes more difficult for the family member to take care of them. So this therapeutic intervention can focus more on communication style, how to be again assertive, how to express their anger when they are feeling angry, and how not to just blame them. That is one part we can be in. And stress management, how to manage their own stress. Yeah, that's what I feel.
So, building on that, could you help us understand a few ways of stress management or self-care which the family members could indulge in to help themselves better take care of the patients with schizophrenia?
Sure. So as I said, maintaining barrier is something they have to work on, and because they may end up not meeting their friends, giving up the social gathering. So, and that may add stress to them. So that is one part, that maintaining barrier is very important, and at the same time engaging in activities that gives them pleasure, and talking about their anger, about their frustration to the loved one or to the therapist even, learning to cope with it, that how this frustration and anger can be managed, and trying some relaxation technique for themselves, engaging in yoga, engaging meditation practices. So this could be some of the things that they can try for themselves to reduce the stress. And they have to understand very importantly that it is them, because of them, if they behave appropriately and support the patient in their in their having the hard time, because of this behavior, their stress is going to reduce, because they are adding stress to themselves and they are not aware of it. If they can be mindful about how their behavior is affecting the patient, then that will also eliminate a lot of stress that is happening.
Thank you for explaining that in detail. As we are talking about family and community and the support group we have, I would like to ask Ms. Asmita ma'am that the role of support and family groups and in rehabilitation as observed through the Tridul Group Foundation.
Uh, I feel support group is very much important for the health of the caregiver. Basically, support group is a platform where caregivers can share anything and everything. The things which it is difficult for them to share even with their relatives. That is the first thing. Second thing is that uh, another caregivers can learn from other people's experiences, like especially how to handle someone. Suppose my child is not taking medicines, so if that particular topic is discussed in the support group, then there would be n number of people coming with "Ki, I have tried this, you try this, I am giving the transparent medicines, or I have told family doctor and I am giving these tablets with under his prescriptions." And means you will get at least few ideas, and one of which may work with your child. And other thing is that once you enter into the family group, rather support group, you will realize that you are not the only one who is fighting. There are so many people like you, and then you get that confidence. If they can do, why can't I? For me, on the personal level, the support group was very useful in me, in such a way that I was thinking that I have a grave problem, that my husband has schizophrenia. But when I heard the stories of other people, then I realized that I am lucky. If it is to be schizophrenia, it could have happened that my husband would not have a job, or he would have left the job, or he would be just sitting at home. But it is not the case. He is doing the job very regularly. Uh, uh, he is bearing all the family responsibilities. Then why should I grumble? So my attitude towards my husband has changed. Means I started feeling proud of him, because even though he has everything, like he is doing, so it is means he is struggling, but he is trying to help the family. So that respect towards my husband has increased. Naturally, my communication with him has changed, as a result of which the bonding has increased, and we could arrange the further relapses. So naturally it has helped the prognosis of my husband, because then he developed the insight very fast, and he himself started reporting the things to doctor without my telling him, or without me uh, poking him ki you should go. So that is on my personal level. Then we have seen, usually in support group meetings, we talk more about, we tell caregivers to focus on the things which are within our control, and not on the things which are beyond our control. Like as I said, why, what will happen to find out the why you want to find out why. Now let us see this is what is in my hand, that giving the proper treatment, taking to the doctor regularly, visiting the counselor regularly, these are the things which we focus. The another thing is that usually in India, the psychiatrist to patient ratio is there are very few psychiatrists in India. So naturally psychiatric doesn't have uh, enough time to spend with the patient. So if the caregivers can write down their symptoms, and in a format like frequency, intensity, and duration. Then in one stroke, psychiatrist can understand what caregiver has to say. And plus it will be objective data, because usually caregivers go to the psychiatric with a lot of emotions. And when they talk to the psychiatrist, it is more of a emotions which are poured on the psychiatrist than the actual symptoms. So if you just write down this way, like frequency, intensity, and duration wise, then it will be better for psychiatrists to understand what exactly the whether the patient is progressing, or whether he or she needs the changes in the medicines, which the psychiatrist would get objective data. So like, we insist that the caregiver should uh, report a psychiatrist in this particular format. uh, then as I said, we encourage our caregivers to uh, involve our extended family members or neighbors, so that they can share their burden. Then, as Kushal said, uh, we encourage them to have their me time. We always say that my patient is a very important part of my life, but my patient is not equal to life, which is the mistake all caregivers do, as a result of which they burn out very fast. So we always tell them, no, it is an important part of your life. And like, we always say them that yes, when there is a relapse, when there are symptoms, or that time your priority would be your patient. But when the symptoms are subsidized and when he is okay, that time you should just back out. Another thing is that we always tell our parents that, like, you should look at him or her as a, say, suppose if my child is 35 years, the 35 years old child. So everything you just don't blame on the illness. 35 years old child, or 25 years old child, or 16 years old child, he will, even though he has the illness, he has his own personality. So he will behave according to the age. It is not that everything is happening is because of the illness. Because everything, like, they will always put it, because of this illness, he is behaving in that way. It is not that. Maybe it is because of the personality, it is because of his age, he's being that. And another thing is that we also encourage caregivers that if they need, they shouldn't hesitate to take professional help for themselves. Because caring for a schizophrenia patient is a 24/7 job. And it really means there are two types of burden. One is a practical difficulties which caregivers face, and another one is how they perceive these practical difficulties. And because of this, they are under tremendous burden, and that too 24/7. Plus they have to alter their lifestyle, or they have to modify their goals. They have to do lot many sacrifices and adjustments in their life. So naturally sometimes they feel like, burnt out. And then I feel they should go, as Kushal says, that for theory. But I would go one step ahead and say, if needed, they should go to psychiatrist and tell that I need this, and as a result of it, I want some medicines. And naturally the psychiatrist would be in a better position to see if they really need any help or that. So this is what a support group, I think, is a very important, or plays role even in the health of caregivers. And another one is, as you say, in rehabilitation workshop, usually we try to give soft skills. And it is not that we have any tailor-made, it is not that we have a particular program as such. See, our age group is, say, 35 plus, or age, yes. And suppose if we are calling every day, then we have to give them some work. So like, we do different type of things. Like, especially we are in food products, because making a food is a skill which can be easily taught. and it doesn't know much of a skill, like you can just supervise and do the things perfectly if everything is weighed and properly managed. So doing these things, like we teach them how to work in a team. Because at any time, whatever things we are doing, we are always doing in the team. Suppose if we are doing some packaging, that time also putting a label, we always keep them in a pair. One will be the senior patient, one will be the newly added patient. And then they will have a sort of peer counseling. They will chat with each other. Like, he will say, "Ki, are you taking medicines? Are you doing follow-up? And there is no harm in taking medicine. You should come continuously for the rehab because I have been benefited." And then, like, it is a sort of peer counseling. In this, like, they try to get adjusted with each other, first thing. Second thing is that they try to adjust with each other's speed, because even if they are putting the label, one is taking the label out from the sheet and another one is sticking it. So naturally, they have to match the speed. So that adjustment they learn to, uh, like, then they slowly understand that yes, this is a platform where I can talk. And actually our senior group members, they act as a catalyst. They help us in, uh, making the new people adjust in the group. uh, Another thing we do is appreciate small things. I would like to give an example. There was one guy who was around 40 years of age. He was married and has a child. And he was working, he was functional, he was working, but in between he had a relapse and he just left the job. And so doctor told to come for rehab, and he started coming. He being a marketing person, he used to come in a means shirt. He used to tuck the shirt and full sleeve shirt. He used to come on a bike. So actually for a 40 years old married man, this is very common. He won't get appreciated for this. But when he started coming to a rehab center, that time other kids started appreciating this. Arey, so nicely you are dressing up. So nice your shirt is. Oh, you are riding a bike. Oh, you have a family. You are taking care of your child. So he got a lot of appreciation, which I feel was needed for everyone, which he was lacking. Because see, these are the things he is supposed to do. A normal 40 years man should supposed to do. There is nothing exceptional he is doing. So he was not getting that what he needed, but he got that appreciation. And he was like, he started coming regularly. His functionality has improved. Of course, this is not the only one thing, that appreciation, but yes, that appreciation was very important. And he was with us for 2 years, and after 2 years he just left and he is doing a job again. He is not doing very great job, but yes, he is going and he is integrated in society. So I feel ki appreciation is very much important, which these people, they might not get in a society, which we in a center, we give it. We appreciate them for small things. Then in center we have group therapies also. Hmm. We talk about their fears. Then as he said ki social skills type, so we do role plays, huh? Giving the situation ki, suppose if you are going out and if someone asks the questions, how you will answer. Why you are not mixing with the society. So they will say something like, they will ask me the questions like, how much you are educated or what are you doing now. So what should I answer? Then then we will do the role plays. And then we will means we will try to sort out their own fears. Then every time they feel like, ki my anger is because of my illness. Then whatever emotions, we try to normalize the emotions. Like, the anger, fear, these are the emotions of everyone's emotion. It is that you are unable to control it, that's why you need the medicines. And again, we talk about what all the people, means what everyone does to express their anger. Means like, and even we volunteers share that. Suppose if I am angry, even I feel angry, then how I will express my emotion? What I do if I feel angry? I usually say I go out and I wash the bathroom or toilets, and I just spend my excess energy in doing that, and my work is also done. So everyone starts sharing their experiences, what they will do. So like another thing, like we have seen that their compliance to treatment has improved. As I've mentioned in the first example, they they will talk with the peers and they will say how important it is to take the medicines. Like that, just once we enter, we just have a prayer, and then someone will write on the blackboard that have you taken today's medicine. So like that stigma which is attached to taking the medicine is removed by themselves. It is not that volunteer will go and write. It is one of the patient only will go and write. So now they don't mind that. Another thing is that uh, another example, like one boy started coming, and like he was not ready to come because inconsistency is the only consistent thing with schizophrenia. So he was very inconsistent in coming there. Sometimes he used to start from home, but he will just go away somewhere and he will not reach the center. So his parents used to come and they used to leave him up to the center. But slowly other senior kids started talking to him, we all started to talking to him, and now like he has become a pillar for us. Like he has become so dependable. Like whatever things we tell him, we just tell him that yes, we have to do we have this much order and we have to finish off this job by tomorrow, and the things are done. Means like he has done means it has done wonders. He has completed his education and now he is doing uh, online course of what is that, uh, tally tally course, because he has done his commerce, and so we are after him that you should finish the tally and then we will see. You should not stay here, you should go out and work, and we are really, we feel that he will go out and he will work. Means that is a total social integration of. So these type of cases are very few, but yes, they give immense satisfaction to us. And we are not, as doctor said, we are not giving CBT, but through our work we are trying to instill all these things into them, through group discussions, through film discussions. We have sessions of film discussions also. So we have seen that changes also. Initially, like it was the discussions were just very concrete. That in the film, someone has worn that type of sari. There was one wedding, and this fellow has done this, and that's it. But now they have started talking about the emotions, and they have started reading lines between two, hmm, like in between the lines, and their attention span has improved, their concentration has improved. And I feel it is because of the constant efforts of all the volunteers, parents, and of course patients themselves, because this took a lot of time, say around 8 to 10 years. But now we are seeing that the new patients who are coming, they are very intact and they learn the things very fast because they have very less cognitive deficits. Even their emotional expression is also good. So this difference we are finding it over the years. Like my old patients, say like around 10-15 years patients and today's patient, there is a lot of difference in their functionality, their prognosis, and their social skills and everything. So I feel it is because of the awareness, the availability of the knowledge, and the new drugs which are making a lot of difference. So I feel it is very important that we should have support group and we should have these kind of rehabilitation workshops where caregivers as well as patient, they feel secure and they can ventilate themselves and they can improve themselves, and especially patients, and then they can be integrated in the society.
Thank you so much. Thank you so much for explaining us that there is hope. There is rehabilitation programs available as well, where they can actually join and come back to the community and have normal functioning, close to normal functioning. And I thank you all of the panelists for being here today and explaining us different domains of what comes under in schizophrenia, the treatment and the prognosis. I would also like to request, I would like to invite Dr. Rahul. He's the Deputy Head of Symbiosis Center for Emotional Wellbeing, to introduce our upcoming course of BSc Mental Health. So we welcome you, Dr. Rahul.
Yes. Thank you, Rachana, for. Hello, Rachita. Thank you for the kind hosting for this event. I thank Dr. Ajit Naik and Kushal and our speakers, Smita ma'am, for joining this event and throwing a light on how schizophrenia can be managed well with the collaborative efforts from all of us. And I just want to share BSc Mental Health. This is the newly launched program by Symbiosis Center for Emotional Wellbeing under Symbiosis Institute of Health Sciences. And this is a 3-year degree course that we are offering after 12th standard. It is open for all streams, including arts, science, and commerce. And this course has some highlights, like it is something focused on making a skilled mental health professionals, and it is aligned with national education policy. It has an in-house mentorship and 2 pre-placed internships also we have for this program during this 3 years tenure. And this will be a good opportunity for 12th standard students if they are interested in pursuing mental health courses or any psychology advanced course degree programs. They can definitely consider for this. And we have our contact number and our email ID for the inquiries. The admissions are open now, and we are going through the roster admissions now. So I hope this course will also help all the students to be the part of this collaborative treatment program and get understanding through it. And it can offer a lot of better opportunity for the patients having mental illness in future. Thank you very much. And I take it over to our host, Rachita, please.
Thank you so much, sir. Thank you for introducing the program. I would like to thank once again all of our panelists for coming in today and on Schizophrenia Awareness Day and helping us understand better of this illness and how to actually go about it. Thank you so much.
Thank you, ma'am. We can stop the stream.